Hello, today we are going to talk about erectile dysfunction, which is also known as ED. There are many real cases that can be observed through erectile dysfunction. It is different based on what causes the disease. Male sexual arousal is a complex process that involves the brain, hormones, emotion, nerve, muscles, and blood vessels. Case 1 is caused by acetylcholine. In case 1, a 39-year-old Caucasian man, a cirrhosis patient, has a healthy lifestyle without tobacco, drugs, or alcohol. He also didn't have major surgery. His routine blood tests, hepatitis markers, coagulation parameters, thyroid function, and chest radiography were normal, yet he still experienced ED. However, he took acetylcholine for the treatment of cirrhosis that affect male reproductive system. Case 2, a control study of erectile dysfunction among men diagnosed with panic disorder. In case 2, the case determined whether their anxiety and sexual arousal are related, and the chronic anxiety can cause the sexual dysfunction. The result of this study confirmed that the panic disorder can lead to ED. In case 3, a 57-year-old patient was diagnosed with erectile dysfunction. In his case, it was caused by smoking because he has been smoking for 37 years, which can affect the circulation of blood to the penis. Causes of ED divided into two: psychological and physical. Psychological causes. First, stress. Someone might have a problem regarding works, relationships, study, and others. Next, anxiety. Someone will worry about his body appearance. Third, depression. It is caused by chemical imbalance in the brain. It can affect both sexual desire and sexual function. And next, indifferent. It happens when an individual loses of interest in sex or facing a problem in a relationship. For physical causes, we have heart disease, high blood pressure, diabetes, obesity, and alcohol. In heart disease, coronary heart disease occurs when plaque builds up in the arteries, then impairing the functioning of blood vessels. It restricts blood flow to the heart, and in this case of ED, to the penis. Next is high blood pressure. A man with hypertension are likely to have impaired penile blood flow. High blood pressure damages the artery walls and reducing the flow of blood to the penis. In the case of diabetes, a man with diabetes, especially type 2, often have low testosterone level, which can affect their sex drive. It will cause the inability to achieve or maintain an erection. For obesity can cause ED by damaging the blood vessels and decreasing testosterone. Blood vessels is damaged due to the hypertension, diabetes mellitus, hypercholesterolemia, hypertriglyceridemia, and inflammation. For alcohol, if a man tipple, it could lead to temporary or long-term erectile dysfunction. During temporary erectile dysfunction, consuming too much alcohol can affect both brain and penis. Most common effects are premature ejaculation and loss of sexual desire. Next, we will talk about signs and symptoms of erectile dysfunction. Sign and symptom. First, regularly struggling to achieve and to maintain an erection for sexual activity. Next, reduced sexual interest. Treatment of ED. Before this condition happens, several interventions can be made. First of all, regular checkup and medical screening tests need to be done to detect early signs of ED. People with diabetes, heart disease, and other chronic conditions need to manage their illness with the help of doctors. Practicing healthy lifestyle can also help, so it is better to stop smoking, limit alcohol, and exercise regularly. Next, manage stress level. Lifestyle modification also works. Patients are preferred to start with aerobic exercise or commonly known as cardio. These include brisk walking, jogging, running, and swimming. Besides, Kegel exercise can also be practiced. This type of exercise helps in strengthening the pelvic muscle and effective for men to regain full function of the penis. Counseling can majorly help in lowering stress and anxiety that are related to sex. The first line of treatment for ED is through medication, particularly the usage of PDE5 inhibitor. It causes dilation through the blood vessel, allowing more blood to flow through the penis. Prostaglandin E1 works by opening blood vessels to relax most muscle. Next, testosterone gel helps improving the erection of the penis. Doctors also can suggest penis pump to the patient. The pump will increase blood flow into the penis that is easy for erection. When pump and exercise do not bring positive outcome, surgery is considered as the last option of the ED treatment. The most common surgery is the penile implant. It is a prosthetic implant that involves insertion of artificial rods into the penis. As for vascular reconstructive surgery, it is done to fix blood vessels that causes ED. So that's all you need to know about erectile dysfunction. Thank you for watching.